Milburn has been practicing holistic dentistry for over 20 years, and he's very excited to talk to you today about why you need to incorporate supplements and herbs into your lifestyle. Next, we have Dr. Jayshree Sawhney, who is an amazing biological holistic dentist. She's been practicing for many years, and in the past several years, she's dedicated her life to being able to help her patients through the use of safe protocols. She's also SMART certified. She has gone to extra certification courses on the uses of homeopathy. She has extensive knowledge on, and she uses it every day on her patients with their direct patient care, uses supplements and homeopathy, and she's an incredible wealth of information. And then next we have, of course, our own Ella Gashinsky, who not only runs this amazing facility we have here, she also is a certified nutritional counselor. She is a wealth of knowledge on supplements, homeopathy, essential oils, and herbs. And she actually has a few personal stories that she'll share with you later on why incorporating supplements and herbs in your lifestyle is extremely important and how it can help you in your total body wellness. And then, of course, it's myself. My name is Fran. I am a biological hygienist. I started that way back in 1984, and now I'm revisiting it again. The past several years I've been with Dr. G, and they've all reignited my love for the holistic practice. So I am so excited to be able to say that I've been able to control oral diseases with the use of supplementation, herbs, and other modalities, and not using prescriptions and chemicals. So there you have it. This is our panel today, and we're going to go through a lot of the myths and share the truths and the answers with you. Now, a lot of you may have questions that you want to ask, and we want to be able to get to them as we can, but we have so much information we want to share with you. So you can type in your questions, but probably it's best to save them to the end. We're going to get to who we can within the time frame that we have. So if we don't get to your question today, definitely at some point we will. So please just keep them coming, and we'll help you as much as we can. Now, first off, not everybody knows what we do and why we do it and who we are. And why did we actually pick this topic today? Why did we actually select, supplements and homeopathy when there's so many things that we can discuss? And actually, I'm going to ask Ella to be able to review that with you about who we are, what we are, and why we picked this topic. So Ella, could you please share that with us today?
Sure, I'll be happy to. Thank you, Fran. In our community, we're very well known, as the holistic dental practice. But this is not the only thing that people know us about. They also know that we created, a center, of education for wellness and healthy living here in Melbourne. Our story goes 20 years back, when me and Dr. Gashinsky decided, to open a very unique practice, dental practice that, will not, use, a lot of chemicals and harsh medical or medicine rather, that usually is used, traditionally in dentistry. Because, granted, everything that we do, in dentistry, fields, have a lot of, chemicals in. And, this is unfortunately unavoidable. And sometimes, those, chemicals are quite harsh and, take, really big toll, on patients' health. So when, we decided, to do so, we realized that, we're going to have to take a matter in our hands and start educating public on more healthy approach, to dentistry, and more healthy approach, to their health. Granted, 20 years ago, not a lot of people knew about holistic lifestyle, because the holistic movement was not on the rise yet. And we realized that in order for us to grow our practice and help more people, we need to start educating our public. And we need to start grooming this public, to become our own patients. So we organize a lot of seminars. We did lectures, at Whole Foods. We rented the space at the library. We had presentations, during the holistic, health fairs. And every time, we did this, we saw, how, people actually responding to it. They were very interested, in knowing what exactly, we can do, for them in our office. And that's, how we actually, grew and, groomed, our own patients. We were growing, and we were growing very fast. And finally, 4 years ago, when we decided, to expand, and build our own place here in Melbourne, we kept in mind, the idea that, we really want to have, those educational seminars and lectures here in our office, to, be able, to help, patients, to understand the necessity of, having, some detoxification process done, for themselves, how, they can, stay healthy and vibrant and live, really healthy lifestyle without taking any medications. And it became a tradition. Every year, we twice a year actually, we open the door, to people in our community, to our patients, and we actually try, to make those events, really fun. It's not, one of those boring lectures that you go and you fall asleep, during those lectures. It's, really interactive. It's a lot of people that come in and they really enjoy, everything that we put together. We have, our patient, who is a musician, and, he always brings the band, and, he plays the music during those events. I personally cook, for those events myself. My kitchen is actually gluten-free and completely organic. And I teach people that, the food that, you eat, is a healthy food, should not be really boring. This food is fun and the food is enjoyable, and you can actually eat healthy and have fun, doing this. And, our patients, love my food, and, always asking me, for the recipes, and asking me, when the next time I'm going to make the cookbook for them. So we do, a lot of raffles. And most importantly, we bring holistic practitioners from different trades, nutritionists, acupuncturists, homeopath. We have integrative physicians, coming and sharing their knowledge, with everybody, who want to learn about, holistic way of life. Everybody, who knows some stuff but want to learn more. Everybody, who actually looking forward, to, do that, and become healthier. And, for that, we have, all of those practitioners, coming together, and, they sharing their knowledge with them. After, every presentation like that, we ask our patients, what do they want to know next? And, during this time, we giving them, the surveys that, they usually filling out. And we did exactly the same thing, last time in October. And a lot of patients actually answered that they would like to know what they can do at home, what kind of supplements, what kind of homeopathy, we would recommend them, to use, and what exactly, we use in our office. Well, granted, we love, doing those seminars, in our office, we would love, people, to come. But lately we realized that, our place is not big enough, to have, everybody, who would love, to come in and participate in our events. In fact, back in April, we had more than 75, I believe it was close to 80 people that came, and we had to run presentation 3 times because, we were not able, to accommodate everybody at the same time in the same room. And that's what actually, gave us an idea that, maybe, we should go bigger, and, we should do those webinars, where, we can share this information and, help, much more people. And at the same time, be, everybody, to be in the same place, and, learn, what, can be done. And that's how, pretty much, we came to the idea of having those webinars.
Amazing. It's amazing where you started, where a lot of people didn't know what you guys were doing, to now you're educating and bringing people into the fold and helping people beyond your walls. It's just amazing. And I want to ask Dr. G now. We know that there is a correlation. Believe it or not, the mouth is attached to the body, so it's hard to believe. But so, what is your why? Like, why are you practicing holistic dentistry? And why are you recommending the supplements? Like, what is it that makes you want to do all this?
you know that we're going to start with this holistic dentistry, because it's a lot of definition. What is holistic dentistry? One of them, this is how you look at the patient. You look at the whole, as a body, mind, spirit. And this is very important, because how much we know how the body works. You know that the basic training we have at dental school, and I went through 2 dental schools, and I used to teach in dental school myself. And you know that it's not basically enough to really help patient to get healthier. You have to start learning, you have to start reading, and you have to go to the people who are just preparing the future for the medicine now. You have to start reading the very difficult and complicated books, that you start to understand how the body works more, and you really start going to the 6th dimension. They're talking about the quantum physics in medicine and the future, how the body communicates. It's a lot to learn. And then you're talking about how the mind works. It's so much. Humanity tried to figure out how mind works for thousands of years, and it's still a lot of unanswered questions. And the spirit, it's very difficult to read somebody else's spirit. Hopefully, I feel it sometimes, but it's big task. But why? I'm just going to answer what is why for me. For me, why? Then I look at the patient, I really want one thing. I just really want them to be healthier. To healthier to move, to healthier to live, to healthier to enjoy life, to remember their names after age of 85 or 90, to remember their spouses, kids, and everything else. And this is important. And this is not something just came out to my mind, because we know that Alzheimer connected to any infection, in the body, that any condition that really create a response to the body. And this is a big thing for us. We start thinking about what we can help individual patient to get healthier with. As a holistic dentist, we're trying to figure it out what really destroying patient health, how affect their dental health, their entire health. It might be toxic materials in the mouth. It might be some metals in the mouth that patient allergic to. And a lot of patients are allergic to nickel, for example. And it might be allergic reaction to dental fillings. It might be infection in the gums, in the bone. And this is very important for me, just educate all my staff, all my patients, that how we can help them to become healthier. And this is most important task. And now I become a student to the rest of my life, how to help patients to be healthier, because I'm really learning art of healing people.
Wonderful. Now, I know there's a lot of questions about mercury. What are your thoughts on that, real quick, before we move on to the supplements?
You know that mercury, it's a very easy topic, because when they taught us in dental school, it's quite not understandable to me, because they said it's safe material. The minute we remove the self material from the patient mouth, it becomes a toxic waste, and it's quite not understandable to me. And for me, I know that some patients cannot handle even a small amount of mercury. Some can handle 10, 15 fillings in their mouth, and their immune system working great, but some cannot. They just been loaded with a lot of toxicity around them, in our water, in our food, everywhere around us, that, and they can handle it. And for me, if we're going to remove this silver filling, sometimes we see amazing results after we remove just few amalgam fillings, and people feeling it, and it's make a big difference for us. And in holistic dental office, we're trying to use the supplements to help patients just go through the stress of removal of silver filling. Very important. And we have to look on how the patient detoxify and how the digestive system works. And this is herbs coming to help. And this is herbs known in humanity for thousands of years, and it works.
Wonderful. Thank you for the background. You guys have set the base of why we're doing what we do and why we love to do what we do. So now now that we have some background, I want to get into those myths about the supplements and homeopathy, so we can actually get to the nitty gritty of all these myths. So first of all, Dr. G, let's address the first myth, and that is herbal supplements don't work. What are your thoughts on that?
It's not true. Because you know that herbal supplements known to human being for the thousands of years. And it works. And you know that it's really just help. You know, it depends where to use it, how to use it, the time span, and you really need to look at the application. And you do not expect immediate result from using herbal supplements. It takes time. It takes a real diligent approach. And I'm lucky enough, I met a very good herbologist, you know, that he's trained in Chinese medicine, he's trained in the Ayurvedic medicine, and he created a lot of good herbal supplements we use in our office. And it really works great.
Wonderful.
Right.
Now, I do understand, you know, a lot of times there's very easy things that you can recommend to use, like some supplements and herbs that you can find in the grocery store when you do the mercury removal, right? Things, you know.
Yeah, for example, cilantro. You know that you look at cilantro, it just have huge, great qualities. And you know, half cup of cilantro, organic, obviously, it's just great help for you because it's really just help you just detoxify your body.
Right.
It's not doing complete mercury detoxification, but helps a lot.
Yeah, definitely. And, you know, things like charcoal, the cilantro. I mean, there's a lot of things
Sure,
that you can definitely
sure.
get
You
over the
know that
counter.
cilantro charcoal is great. You know
Yeah,
that
Doctor.
we've known from the hundreds of years about the charcoal, and we know about cilantro. You know it from the time immemorable.
Right.
Yeah, and Dr. Sarni, what are your thoughts? You know,
Yes, no, I totally agree with Dr. G, and you know that a lot of these supplements, herbal supplements, as you know, this day and age, we have so many people allergic to so many different things, different compounds. You know, they have resistance to antibiotics. There's so much in that's going on in the market, just so many toxicities and things that people are allergic to. So it really, for me, it opened my eyes up when I treated my own mom here at the Holistic Dental Center. For years, she had perio and she had periodontal disease, and you know we used the conventional stuff that's taught to us in dental school, and we couldn't get rid of her perio. I wasn't understanding why we couldn't stabilize everything, and we put her on some herbal regimens, you know, and I was shocked. I was shocked. Till today, her perio's gone. That was a result to me. And that's what I see not just with my mom, but I've seen it with a lot of different patients that have walked in the door here, which makes me, you know, I have to see something to believe in it. And that's what I'm seeing. When I see results that we're using these protocols and I'm seeing a difference, it just amazes me. And every day is like I'm at Christmas every day opening a new gift, because every time we add a new protocol or do something new and I see the result, I get so excited. It's like a kid in a candy shop. So I just love that. You know, I really
yeah,
love that.
that's exactly why, you know, he reignited, you got everybody, this is Reignited My Love. I started in 1984, and then here I am in 2017, and I reignited my love for all this stuff. So thank you for that. Now you were talking about with gum disease and all that, and how like using herbal supplements with your mom. That brings up the next myth. Um, Herbal supplements are only used for prevention. So what is your take on that, Dr. G?
Oh, no, it's just used for treatment. In our office, it's used for treatment. Because you know what, prevention is a great thing, and herbal supplements wonderful. But in our office, we have a protocols that we use it for treatment of gum disease. They use during amalgam removal. They use it during the difficult extraction, during the implant placement. I just want you to look at this microscope. Every patient come in our office, they have a little swab taken underneath of the gums, and the bacteria sample put under microscope. And we look at this microscope, and we just evaluate the bacteria. And we look at this, and we decided on the, depending on the activity of the bacteria, what kind of herbal supplement. You
Gotcha.
look, for example, at the natural antibiotics. What is natural antibiotics? This is oregano oil. This is great stuff. Oregano oil, it just works like a natural antibiotics. Yes, it works slower than just real chemicals that we just buy in the pharmacy, but it really works.
And then I know, Dr. Sarni, did you have your mother on like on any of the herbal mouthwashes?
So we did. We actually, put her on a whole protocol here in the office, and we, as you saw, the phase contrast, microscope. We took a sample of her slide and took a slide, and we found the culprit. We found amoeba, and when we saw amoeba, I was just like, oh my God. And then we put on a whole, protocol for a few weeks, and then got her deep scaled and everything. But I think deep scaling alone, which we'd done in the past, didn't give me the results I was looking for. And once we put on the herbal solutions, and then we saw her slide a few weeks later, and we saw that the amoeba was destroyed with just natural stuff. We didn't put her in any regular antibiotics or anything. Like, we just used herbal solutions and went through the whole protocol and put her through that. And I was so shocked. Until today, this is 5 years later, she has not gotten periodontal disease again. It's very stable. Her pockets are great. I love it.
That's fantastic.
And
Also,
if you look, I'm sorry, friend, if you look on our mouthwash, it contains 14 herbs.
Mm-hmm. Herbs and
14 herbs, CoQ10. Yeah, everything.
It's
just wonderful. That herbs, CoQ10, it's a really, really health put together in one small bottle of the mouthwash.
Yep.
And it's amazing
health self.
How a lot of times you go to a conventional office and they give you this prescription where you have to get this bottle of this blue stuff, and it tastes terrible, and it makes your teeth stained, and it throws your taste off. And guess what? It doesn't kill the bacteria that's in the gum line. And
that's the bottom line.
It's amazing how it's, And then I know Dr. Sony was telling me about how it really helps dry mouth also. A lot of these supplements are help with the dry mouth. So it really, there's so many things that can be done with just natural products, herbs and supplements. And Ella, I know you're the guru on essential oils. So, I'm going to ask you a little bit about, essential oils, because I know some of the essential oils are in the mouthwashes and some of the herbal solutions we use in the office. So.
Absolutely. Yeah. I was listening to what Dr. Gino mentioned, that, the oregano oil, is known, for thousands of years. And, everybody know that this is, just, the essential oils, but, not everybody know how popular it is, and, how powerful, actually the effect, of, those essential oils, in our daily life. In our office, as you already mentioned, we use, the mouthwashes, and a lot of protocols that we have actually, contain, the essential oils. But, also, a lot of people know that actually what effect, chemicals, and household, cleaners actually take, on our health. People know about it, but they don't know what they can substitute, those chemicals with. So I have a news for you. In our office, even, to clean, our, counters, to clean the surfaces, to clean the floors, we don't use any chemicals. It doesn't mean that, we're not, disinfecting our office. Our office is very, very clean. But the only products we use is the household cleaners with essential oils. There is an incredibly clean and reputable company on the market, called Young Living. And, they have, essential oil blends that actually in combination, with, other natural, substances, create, the products that, you can use. Here we go. You see?
Keep a little in my pocket.
Right. So, we can actually, use, those, products, for, disinfecting the rooms, in the office, for cleaning the surfaces. In our office, we run diffusers with essential oils to clean the air, all day long. Every room, has the diffuser, and, we use essential oils there all the time. We also, use a lot of essential oils, that, our mouthwashes, have, as an ingredient. Also the toothpaste. Well, I'm talking about, general stuff, but, I actually would love, friend, to talk about the do-it-yourself, toothpaste that, she created. And here is her recipes, of, what she can do. It also, has, essential oils in there.
The reason why we love the essential oils is because they're natural antibacterials. So you go to the store and you see all these fancy toothpaste. You have no idea what to pick. You got this one and that antibacterial whitening. That you don't know what, and it's all chemicals. Here you're using peppermint oil, which we know is an antibacterial. You're mixing equal parts of baking soda and coconut oil to make a paste, and you add a little bit of the xylitol if you have it, if you can get it. And that xylitol also helps arrest decay, and it gives it a little bit of a sweetness, so it's not as bland. But the recipe like this can really make a difference. First of all, it's cost effective and more effective than these chemical toothpaste that you use. And actually, we have a lot of recipes in making your own mouthwash, making your own toothpaste. If you go to our YouTube channel, Holistic Dental Center NJ, you're going to be able to find all your do-it-yourself recipes for a whole bunch of things that you can do for yourself at home. So don't forget to go to our YouTube channel also. But yeah, it is so easy. I keep a little jar of it in my bathroom. My husband's like, "What's this?" I'm like, "Don't worry about it. Don't touch it. It's mine." Okay. You will make your own. So,
so you don't share.
No, that's mine. So yeah, that's there's so many things you can do with essential oils and all that. So what I want to do now is I want to go to our third myth. Now that we've had a little fun, I'm going to go to our third myth, and that is homeopathy is a placebo. Now, I'm going to ask Dr. Sani about that one because she's the pro on this one. And this one made the hair on the back of her neck stand up when I said it.
Yeah.
So go right ahead, Dr. Sani.
Thank you, Fran. So when I first heard about homeopathy, obviously I knew about this earlier on, but Dr. G really introduced me to it and sent me for a course with Fran and Tatiana, and we all went for the course. At first I was like, does this stuff really work? Because I wasn't open to it. You know, I was thinking, oh, this stuff probably doesn't work. I took the course. I brought all these products back. But then I actually talked to a lot of doctors in California and other places that use these things. And I really saw a difference. And again, you know, it was one patient came with nerve damage that had a wisdom tooth taken out and had nerve damage. And I'm like, oh my God, I'm going to have to send you to a, oral surgeon. You're going to go have to get shots, this and that. The guy was scared. The guy was very, very scared. At this point, I said, you know what? Let's try the homeopathy. I put this guy on homeopathy, and guess what? He got his feeling back. And that itself, these experiences are what make me change and use all these products that I think of. And with homeopathy, I've seen so much beautiful results without putting patients on, the regular antibiotics. You can put them on homeopathy, on different homeopathies together, and actually help them heal. And that makes me very happy because with, homeopathy and all of this, people are not really allergic to it. It's very rare that you find anybody allergic to this stuff. So it's great in the day and age that we're living today where there's nothing available, where people are allergic to a million things, to have homeopathy on our side. And it's not something we've made. It's been there for years, thousands of years. It's not something, we've just developed now. But to have that and not use it is what I feel so sad that I think people need to use it more because it really works. It works, the herbal, like the herbs work, as well as the homeopathy works amazing.
Sure does.
Yeah. Still homeopathic remedy, well known for the hundreds of years, and they just never, ever show any side effects. Everything should be used in the right proportion, for the right direction, for the right patient, but you know that nobody ever documented still homeopathic remedy side effect.
Right.
Right.
And I think, Dr. G, you mentioned there's one very famous person that uses a lot of homeopathy.
Yeah, I love this person. Look at her. That probably you can see it on the screen. That this is. Look at this. This is Queen Elizabeth, and she going for the treatment in the Royal Hospital of Integrative Medicine, and basically this was before the homeopathic hospital, and she treated only with homeopathic remedy. Look at her.
How do you like
all
that?
Together, beautiful age. She just look great, and I wish myself to look as good as she is, but I don't want to wear the same hat.
You would look marvelous, Dr. G, I must say.
Thank you.
Um, and also, I know we use a lot of homeopathy for healing and such, but I know we also use it for anxiety, right?
This is Dr. Sunny going to tell you about anxiety.
So anxiety is another issue. You know, a lot of patients, when they come to dental offices, have a lot of anxiety, you know, because of past experiences, or whether it's they had one bad treatment, or they're just anxious in general. You know, again, this homeopathy has really, really helped us here, both in children and adults. You know, half an hour before they come, I give them a homeopathy package. They take it home. Half an hour before they pop up, you know, they take a few of the tablets. And then when they come here, we give it, you know, it's accessible to them. We give it to them right here. And when I hear from my patients, that was the easiest experience, or some of them actually fall asleep. And I'm like, I didn't give you sedation. I just gave you homeopathy. And it's amazing when they're snoring while I'm working on them, because I just love it. And that makes me feel, and especially when I get,
wake up, man.
right. And I get the 4-year-olds, and we give them, you know, homeopathy, which is safe for them. And they also, it brings them, you know, just comfortable. And so we can work with them without using any, you know, any sort of sedation or anything like that, which just gives us more power that we can do this stuff without using, you know, drugs that are available there, like Valium and all this. You don't need that. There are natural things we can use that can help you, you know, bring anxiety levels down.
Exactly. And I believe there's another natural substance that Dr. G, and you also like to use.
This is Dr. Sunny talking about your technology that available for 200 plus years, but now we're talking about something new. It's called New Calm. And the New Calm allowed patient to relax and restore their body at the same time. They don't feel tired. For them, like an hour and a half appointment, go like 10, 15 minutes, and they're using natural supplements. It's called GABA. It's just for the relaxation. They put in pre-sleep condition, and they just glide through the treatment and make it much easier for them, because not everybody can handle the stress of the be in the dental chair. And for us to change patient approach, to come here to the dentist that is scary and bad and everything else, to something that easily just possible to go through, it's a big deal for us, because we're really improving somebody else's life.
Yeah, absolutely, especially with you know, conventional ways of dealing with anxiety, that somebody has to drive you, you can't drive yourself, you have like a hangover afterwards.
Yeah.
So the fact that you're giving somebody something that their body already produces, GABA, and you're giving it in such a way that they can relax during a very anxiety-producing procedure, and they feel very, very comfortable. So it's amazing how, you know, so it looks like we're dispelling a lot of these myths. So, yeah, we're just going to keep going with this. So let's see about the next one. That brings us to the fourth one. When it comes to handling infections, antibiotics, hands down, are the best thing to use. So, Dr. Sawhney, what is your thoughts on that? And there's another one that makes her upset, so go right ahead.
Right. So this is another one that makes me upset, because people think antibiotics are everything. But antibiotics, what they really do is, when you have a problem, it just helps you kind of put a Band-Aid over the problem. You know, it doesn't really get to what's causing the problem. It's just putting a Band-Aid till you feel better, and then you can deal with it. With homeopathy, the way it works, which I love about, you know, traditionally we would put every patient who had every extraction, every root canal, you know, on antibiotics. And now we're seeing, with more and more resistance issues and all this other stuff happening, we don't want to put every patient on, you know, antibiotics. So again, you know, the homeopathy comes into action with the herbs. You know, it's just amazing. I mean, I do a lot of procedures, and I put patients on homeopathy, and I get the same results I would get if I put them on, you know, antibiotics, or better. You know, we get better effects because it's targeting the problem, where the problem's starting from. And, you know, I just love it, because it just gives us really good results. And that's what makes me a believer. And, you know, I love to share that with my patients, because it really works. And it gives us great results. And that's what we want, is healthy patients. And that's what we're going for.
Absolutely. And it's great to be used in the dental office, and we can use a lot of the homeopathy at home. especially during this time of year when a lot of people are getting sick and such. And I know Ella loves this one particular company, and there's a lot of other reasons why homeopathy is great at home. And Ella, I'm going to ask you to talk about that a little bit.
Oh yeah, absolutely. I am really big advocate, of taking supplements, and homeopathy, in my personal life. Personally, I experienced, some health issues, for years. I was diagnosed, with Crohn's disease more than 10 years ago, and I went, through traditional treatment, with, lots of antibiotics and lots of immunosuppressant drugs, which did not make me actually feel better. They only made me sick. And it was very debilitating because when you don't feel well and you come into work, it's just you're dragging yourself, you don't enjoy what you're doing. And it was really, really difficult for me, even to come to work every day, until I realized that I don't want to live this life forever. And I took the matters in my hands. I learned a lot of how to actually listen to my body and what to do when I'm having inflammation without using all these drugs, by detoxifying myself, by taking supplements, and if I need homeopathy, and being on a strict diet. That's my way of life for the past 10 years. You can look at me, I don't think I look as the malnourished person, and I don't take any antibiotics, I don't take any drugs ever anymore. And if I'm getting sick, the only thing I do is I just take the supplements, natural antibiotics if I need to. And we have absolutely wonderful company that we use in our office for our patients, and I use it a lot in my personal life. It's the homeopathy that comes from Italy. The name of the company is Guna. It's Guna, and they have all kinds of different prescription. I mean different
dosages.
What is it?
Remedies.
Remedies.
Yes, remedies. That's right. They have all kinds of different remedies. And one of them is the most popular in our office among my staff is Guna Flu. What is this about? It's and especially now in this season, everyone it keeps talking about the fact that the flu is coming, flu season is on the way, and we all have to take have to have vaccination done, because otherwise we're all gonna have flu. Yes, that's probably true, but the only thing not everybody remember that you can get the flu vaccine from one strain of virus, but then if this virus is gonna mutate, then you're not gonna be protected and you're gonna get sick again. So, but what this homeopathy does is actually helping you to boost your immune system. And even if you're getting sick, if you're coming down with anything, it actually helps to ease your symptoms and get better much faster. We usually have a lot of Guna flu here in the office once the flu season starts, because all my staff is using it constantly. If they just feeling that they're coming down with cold, they run to Dr. G, give me Guna. And to tell you the truth, you all doctors know that our staff very rare get sick, really, really badly sick, because we're all trying to protect ourselves with using natural remedies. Again, in my personal life, I don't use any medications, only if I am really bedridden and I really have something serious, then I might consider taking antibiotics. Otherwise, I use only natural stuff. And this year, actually, put together the ebook for our patients, and I was giving it as a gift during our last event. I put 24 different natural remedies that can help actually patients to stay healthier, and to use those remedies for themselves, for their kids, because they're all natural, they're all healthy, and they're all very helpful during the winter season.
Wonderful. So it sounds to me that a lot of these myths have been dispelled. It sounds like a lot of the pharmaceuticals or the prescriptions and chemicals can actually be done away with by the use of using herbs and supplements. I mean, there's a lot of myths and thinking that it doesn't work, and why bother? But we've all had experiences where we've proven that it really is extremely effective. So, I mean, it's something that we really, really are huge proponents of. It sounds like that Dr. G and Dr. Sawney love to practice with home supplements and homeopathy. And we always want to try to find the root causes of problems. And once we find the root cause, we can actually address it with a lot of these natural products. And there's lots of ways that we can help people. There's things that we can do to give you a lot of answers to your health concerns. And if we can't help you, we have the answers. We can refer you to people that can. We have a great network of a lot of naturopaths and acupuncturists, as Ella was saying earlier. We have a lot of people that we've vetted, that we work with very closely, because as a holistic practice, we know the definition holistic means as a whole. We're not just treating your teeth, we're treating a person. So we're here to help you get well. So that being said, any questions? If anybody has any questions, we'd love you to be able to write them in. You can send them by. We'll give you a minute or two to type any of your questions. And if not, we can move on. Oh, looks like we've covered all the bases. We have no questions.
We don't have any questions.
Yeah.
I'm not sure if it's a good thing or bad thing.
I think because you did such a good job, Ella, and nobody has any questions.
Right.
So that's fantastic. So what I want to do now is I would love to be able to offer everybody a special gift. There you have it. We've talked about how we use it in dentistry and how you can use supplements and homeopathy at home. We want to be able to dispel a lot of the myths. So I want you to be able to find out what we do here and how we can help you. So to be able to assist that, we want to be able to help you come on in. So what we want to do is, because you've taken the time to attend our webinar, we are going to offer you a webinar special of $100 off your treatment, anything that's performed before December 31st of this year. So for the next month, you can come in and have $100 off any of your dental treatment. Would love to be able to do that for you. Also, because Ella brought up the fact that she worked so hard on that do-it-yourself 24 remedies. You know what, Ella? I'm sorry, I have to do it. Can I do it? I want to offer everybody the ability. I want to send everybody free ebook. All right, we're going to get your emails. We're going to send them off. Oh, we have a question.
We have a question.
Yes. Does your herbal mouthwash have any organic ingredients? Yes.
Yes.
That is, we use a very specific mouthwash that has all herbal supplements. It has certain things like, your peppermint oil, your oregano, things like CoQ10, black walnut. So we have everything vetted. Anything that we use here in our office, we thoroughly vet, which means that, like, for example, any of the dental materials, Dr. Sawney specifically goes through all the MSDS sheets, which is like the ingredient list, and make sure that everything is very safe. Any of the mouthwashes or herbal solutions that we use, like if you're in my chair, we use that the ozone water and Herbal Solutions. We make sure that everything's been thoroughly checked and tested and is vetted to be very safe for our patients. Also, another thing that we do is biocompatibility testing, which helps us be able to narrow down the safest material. So we go that extra mile to make sure that everything we use is been vetted. And everything that is organic can be organic. We want to be able to do that. Like I said, before, that's Dr. G and Ella. That is their life. They don't just practice it. They practice it. That is their lifestyle. So they only want to be able to give that to everybody else that comes to here to their office, or anybody they try to teach. But yeah, so thank you so much for that question. But I really want to go back to, we're going to give you that. Oh, it looks like we have another one. If you're using oregano oil, can you take it continuously, or do you have to take a break? Actually, I'm going to have Dr. G answer that.
That I always talking about the body. Body get used to something even good. That you have to take a break. I really suggest you to take oregano oil if you need it for some condition until the condition improves. And after that, you need to take a break. Anything, you have to take a break. You know that we don't need to do something that is just going to create something that body get used to it and do not recognize like something good. It's a normal reaction of the body. You take the supplements as long as you need it. You might take the supplements for the months easily, and after that you have to take a break. It's a normal body reaction.
Ah, very good. See, we knew he would have the answer. So, any more questions? They would love to be able to answer any other questions or concerns. Even if you're an established patient, you can always pick up the phone. If you're not a patient, you can always come in for a consultation. You can ask your questions. You can take a look around. It's a complimentary consult. You can get to see what we're about and what we offer. So, for those of you, on Facebook Live who are listening in, or those here on the webinar, if you're not really sure, please come on in. We're at 91 Milburn Avenue in Milburn, New Jersey. Our number is 973-379-9080, and we'll be happy to help you in any way we can. So remember, we do have that $100 off your dental treatment for the month of December. So that starts actually just in about 3 hours. So no, but we're not going to be here at 12 o'clock. I'm sorry. So we're going to have to start that maybe tomorrow morning at 9 o'clock. So you can be able to take advantage of that. And Ella put together such a beautiful book on do-it-yourself cold remedies. So I'm going to make sure. I'm sorry, Ella. I'm going to do it.
No, it's okay.
I'm make sure that everybody gets a copy of it.
Yeah.
If they haven't gotten one, if they've been here and they got one, because you know what, you did such a beautiful job, and we really want to help as many people as we can. So, unless anybody has any other questions, this is it for today. And I want everybody to mark your calendars because we have another question.
Yes, it is another question.
We have one more. Actually,
yeah.
Jimmy talks about composite filling can also have some toxicity. Do you offer alternative to both? Actually, that is true. Can you, Dr. Sony or Dr. G, can you answer that?
Sure.
I mean, I want to answer it, but
I can answer. I love to answer this question. You know that first of all, we offer the patient biocompatibility testing. It's a really scientific thing, and I like to be scientific because it's my nature. We can draw your own blood. 7 people in our office train is we can draw your own blood. Phlebotomists, 7 people. It's quite a big number of people, and we can send the specific test and find out what material you're allergic to, which is not. Also, there, as we know that we checked, the friend mentioned, Dr. Sani going through all MSDS sheets. This means all ingredients material. No composite material in our office. He has BPA, BPS, he has no fluoride, no known toxins. And these materials are just checked by us. Also, this biocompatibility testing just gives us clear result which material is good for you. And there is no question we can substitute this composite filling for the porcelain. We're using it a lot, and it's the patient preferences. And sometimes we have to really suggest it because of the size of the filling. And it works great. Porcelain is wonderful. Good made porcelain restoration. It's lasts very long time and just very gentle to your teeth. It's very good question. Thank you very much for this question.
Very true. So yeah. If anybody has any more questions, would love to be able to help, answer them at any time. Otherwise, I think we're ready to talk about our next one. Now that we got this one under our belt, we got the next one coming up in January.
Going to be easy.
And I believe that is on January 11th to Thursday. We're going to send out information about that beforehand. We're going to keep the topic a secret.
Wow.
We're going to tease you a little bit. We're going to keep you in anticipation. But on Thursday, January 11th, is our second in our series of webinar. We have them booked out until 2019. So we have so much information we want to share with everybody that we hope that you come again in January. Tell your friends, tell your family, have them pop on in from the comfort of their own home on their couch. They can listen and find out more how we can help and suggestions we can give everybody to get and stay healthy. Well, we have one last question. We're going to take one last question, and that's it. We have holistic dentists in other countries are using quartz crystals as fillings. Is this something that you might offer in the near future?
Yeah, we have to look at this, because you know that quartz crystal, it's like a glass. You know that in reality it might be added in the inside of the composite, but a real quartz crystal to cut it and trim it, I don't know this is technology available in the United States, but I promise you, I'll look at this.
There you go.
Have to make sure that it's approved by FDA.
Yeah.
Well, yeah.
That's it. So yes, we'll be happy to answer your questions. Again, you can reach us at 973-379-9080. If you want to stop on in to say hi, we're at 91 Milburn Avenue in Milburn, and I want to bid you adieu and have wonderful holidays. We're going to see you again in the new year. New year, new you, with more information. And I want to thank you so much for joining us. And panelists, Dr. Soni, Dr. Gashinsky, and Ella, you've been amazing. It's a wealth of information.
Thank you.
And I can't thank you enough.
Thank you, Fran.
Right. Everybody, be
Have
well.
a nice holidays, guys.
Good night.
Happy
Good night.
holidays. Good night.